Okay, hello, this is Victor, and my prostate cancer was cured by the Cyberknife in 2007. Since going through the Cyberknife, I've been trying to help give the Cyberknife as much positive press as I can. Because the treatment was so painless and did not interrupt my life at all. I was living and eating healthy and exercising, so the prostate cancer was a total surprise to me. During this presentation, you will see a demonstration of the Cyberknife in action. Although the doctor is talking about the treatment of the lungs, much of what he mentions applied to my prostate treatment as well. That's right, the Cyberknife does treat lung cancer, prostate cancer, and breast cancer. And one note that I wanted to make was sometimes it is not the disease that causes the pain and suffering, but rather the recovering from having a hole cut into your body or surgery. And after going through that surgery, you will often be required to stay in the hospital while your body heals from that hole. Now, many primary care physicians are unaware of what the Cyberknife can do, so I've published several videos about the Cyberknife stopping my prostate cancer without surgery. But in this video, a doctor will talk about the Cyberknife being used to stop lung cancer also without surgery. In summary of treatments, the patient arrives at the treatment center for the predetermined number of days based on what's being treated. The patient remains fully dressed during treatments and can go home every day. So basically, it's an outpatient procedure.
What Cyberknife is actually a number of beams, anywhere from 50 to 300 individual beams that when they converge on the cancer and gives high doses of radiation therapy to the cancer with very low doses to the surrounding structures. Radiation oncologists will look at the patient's records to determine whether they're a Cyberknife candidate. If they're a Cyberknife candidate, then the patient goes on to see a pulmonologist. What the pulmonologist is going to do is they're going to place little gold seeds near the cancer. Cyberknife uses those fiducial markers to see where the cancer is. After those markers are placed, we usually wait about a week, have the patient come back in for a chest x-ray just to verify those markers are still there. After that, the patient goes through what's called a CT simulation. And they get a CAT scan of the area we're going to treat, which is the chest, and we implant that CAT scan into our treatment computers. Those computers and our physicists and our dosimetrists and myself then come up with a plan. Once that plan is generated, the patient then comes in and goes to our Cyberknife treatment suite. The patient is then set up on a table by our therapist. The treatment lasts anywhere from 30 minutes to an hour and a half for most patients. The beauty of Cyberknife is that it can track patients' breathing. The patient has the gold seeds inside the lung, and then we also place LED lights across the patient's chest. Those LED lights pick up the external movement of the chest, and so the machine relates the external movements of the chest with the internal movements of the gold seeds. And as the tumor moves, the machine moves as well in synchrony, and so that it can treat the patient and be really precise with the treatment. The machine is actually attached to a robotic arm, and the robotic arm gives it infinite degrees of freedom, meaning it can move anywhere around a patient to treat the patient. Most Cyberknife treatments are done in 5 or less treatments, and a lot of them are actually done in single treatments. And so instead of having a conventional radiation, which is anywhere from 3 to 9 weeks, a patient only gets a week or less of treatment. And for patients, it's really, really convenient.
In this portion of the video, we will look at how to find a Cyberknife facility anywhere in the continental United States. Right now, I am at the website cyberknife.com. And now, to find a treatment center, wherever you are, just go to the bottom of this home screen, click on Find a Treatment Center. I'm going to have to scroll down a little bit. Okay, and by default, several continents will show up. And each icon on the screen represents a Cyberknife facility. And there's facilities in Asia, there's South America, and we're interested in the United States. So I'm going to select Filter by Country. I'm going to scroll down and look for the United States. I'll select the United States option. And now you notice on the screen concentrates on the United States, on North America. And on the left-hand side, I'll enter an address where it says enter address or postcode. I will type in a city. I typed in New Haven, and there's multiple New Havens. There's New Haven, Connecticut. This New Haven looks like Indiana, Michigan, Missouri, Kentucky, and the first one, the one I'm looking for is New Haven, Connecticut. So I will select that one. And by default, if you see my cursor, it's looking for a Cyberknife within 200 miles, no further than 200 miles away from New Haven, Connecticut. And we see there's one in Hartford. There's one in Providence, Rhode Island. Looks like a couple in Boston, Worcester, Massachusetts. And there's Long Island and several in New York and Philadelphia as well. And I'll click on the one in Hartford for demonstration purposes. St. Francis Hospital and Medical Center. There's the information about the facility. Cyberknife in the United States. 94 Woodland Street, Hartford, Connecticut. Zip code. There's a link to the facility website and directions. Now when I click on directions, it's going to show me how to get from my location to that facility. When you click on directions, it's going to show how to get from your location to that facility. I assume that the web server knows our approximate location based on our IP address. And I will close that tab out. And I'll go ahead and search for another. I'm going to go over to the West Coast now. In Los Angeles, California, that's exactly what I'm looking for. I'll select it. There's Cyberknife facilities in and around Los Angeles. There's 1, 2, 3, 4 close to Los Angeles. There's Irving, California, and there's one that looks like Los Angeles, I think. Let's see. It's in Pasadena. 630 Raymond Avenue, Suite 104, Pasadena. And there's a facility website, and again, directions. And once you click on facility website, it's going to, each website is going to be very, very different. It's beyond the scope of this procedure, of this presentation, to show you how to navigate the different websites. Each website is going to have a graphic of the Cyberknife, but the navigation and menuing system is going to be potentially very, very different. So I'll close that tab out. And directions, I'll click on directions again just for demonstration purposes again. And it shows me how to get from my location to that Cyberknife facility, the one that I selected. And once again, it's going to show you how to get from your location to whatever facility you select as well. I'll close that tab out. And I'm going to go ahead and select my city. My city and state. I'll X off Los Angeles. In Charlotte, North Carolina, that's exactly what I'm looking for. And there's, again, a default for some reason is within 200 miles, no further than 200 miles away. Okay, there I am, Charlotte. There's one, it looks like Asheville. No, it's in Greer, South Carolina. And again, facility website, directions, and there's a phone number there as well. And by the way, if you're researching for yourself or for someone else, the phone number once again is there, and you can call there and tell them what information you're looking for and why you would like to speak to someone. Every facility I've ever contacted, everyone is always friendly, very friendly and professional. So we shouldn't have any problems in that area. And that's the extent of this video. If you're researching for yourself or for someone else, I wish you luck in your research. Uh, it's surprising to me that the cyberknife is not more more widely known in the medical community. Like family physicians, they're very busy taking care of their patients, and that's understandable. They're not up on doing a lot of top notch, up to the minute research. They're busy taking care of their patients and providing good service. And there's nothing wrong with that. Uh, Once again, I'll repeat myself. My cancer was cured in 2007. Right now, as I sit here, it is September 2021. My cancer was cured in 2007 because I jumped on the internet and found an alternative to surgery. The doctor that wanted to do the surgery on me seemed to have did some reading about the Cyberknife. I could tell based on the way he answered my questions, but he didn't answer my questions in good enough detail to satisfy me, to where I wanted to let him cut me open. And I called the Cyberknife facility. At the time, there was one just 20 miles away from me. They no longer use the Cyberknife itself, but they do use another brand of linear accelerator. But they no longer use the Cyberknife. But at the time, they had a Cyberknife 20 miles away from me. So I called the Cyberknife facility, worked out some insurance issues, and made an appointment with the doctor. The doctor did additional tests on me and determined that I was a good candidate for treatment with the Cyberknife if I wanted to be treated without being cut open, without surgery. And I said yes, that's what I would like to do. And he made the appropriate arrangements. And every day for 5 days in a row, I stopped and laid down for 45 minutes for 5 days in a row. And they said, okay, we're done. You can go. We're finished for the day. And after the fifth day, that was it. It was absolutely painless, and it was I was kind of paranoid as a result of not feeling any side effects, because I told my wife I didn't think it was having any difference on me. I didn't think it was doing its job, but it turned out it did its job very, very well without interrupting my life. But anyway, I'm getting beyond the intended scope of this presentation. That's how you find a Cyberknife facility. You can just type in the name of the city like I did, or you could type in the zip code. And I typed in 06519, and once again, there's New Haven, Connecticut. I happen to know the zip code for New Haven. So you can go by the name of the city, or you can type in your zip code. And that's it for this presentation. And good luck to you and whoever you're researching this information for. I wish you well. Thank you for watching.